Sir.
All right, we're live. NAF El Centro, joined with my Command Master Chief Eric Hubert and our resident medical expert. We are going to join us for your lunch. We'll put out a disclaimer. Two of us at this table have had a Sealy Market burrito, and we're going to try to stay awake and power through this. I won't tell you which two of us have had the burritos, but it will become evident at some point. So, basically here today to provide information and answer questions that you might have on your mind. We would do this in person, but we're practicing social distancing and we're limited to 10 people per event. This isn't quite 6 feet separation, but we're not showing any symptoms of any illnesses at this time, so knock on wood, we're gonna be fine. Basically, there's a lot of important information to go over today. We'll take the questions at the end. I'm sure most of you are aware the new information is coming in daily, if not hourly, with COVID-19. We want to make sure that everyone's informed the best that we can. While the world's seen pandemics before, the flu of 1918, swine flu of 2009, this is the first test for current generations, and these are uncharted waters for our communities. COVID-19 is going to be with us for a while, but we're going to get through this. We all need to realize this is an environment to live and operate within, and not just something we can fight outside of. It's among us already, and we need to learn how to take the protective measures. Currently, we're in health protection condition Charlie, and that just changed since last night. What does that mean to everybody? So 0 is normal, Delta is the worst. Per the DoD instruction, for health protection condition Charlie is categorized as a high morbidity, morbidity, epidemic, or contamination. We don't have a contamination yet, but there are a lot of people worldwide who have passed away for this. We're instituting social distancing, limiting or canceling in-person meetings and gatherings, restricting travel, and advising DoD, civilian, and military employees and contractors and families the exposure to the risk. We're rescoping our exercises and activities to limit risk to U.S. personnel and institute clearly defined personal protective equipment for our high-risk personnel, such as security, fire, and medical emergency services. Calls for shelter in place indoors, limiting access to some parts of the base. We'll cover those in depth here momentarily. And we've instituted health screening at the entry gate, as well as in each department and tenant command throughout NAF El Centro. Some facts. We've had 0 positive cases of COVID-19 at NAF El Centro, and we currently have 10 personnel on board who are either self-isolating or restricted in their movement as a precaution. NAF El Centro is still a limited concern for COVID-19. Again, we want to ensure the base employees are safe and secure. We're not turning away people that are properly credentialed with the proper credentials at our distributed workforce. Some of you, we're not mission essential at this time, but we're prepared to go there if ordered or if deemed necessary. Essentially, most of our workforce is doing separate shifts or teleworking at this time. And that's across the Navy, across DoD at this point. Mission essential functions have to continue. So what are those? I'll list them. Fire and emergency medical services, air operations, force protection, safety, emergency management, public works, and mass care. That includes the housing, galley, and the child and youth services. Again, there's a ton of information to take in, so at the end we encourage you guys to ask us questions. Again, I got XO in the corner there taking them in, so please send them this way. I'll turn the mic over to Doc, and he'll cover some medical aspects, and we'll go from there. Doc.
Thank you, sir. Nick Bunyan, Flight Doc for Base, for anybody that hasn't met me so far, and for anybody else watching out in the community. I'll start with some numbers just to kind of give people the feel for how severe this illness is and what it means for us here in the Imperial Valley. Big picture, we have a global fatality rate here of 4.2% of those numbers, or of those that have been confirmed. More specifically in the United States, it's 1.4%. So far of confirmed cases, we're doing significantly better than the world fatality rate. So that's the good news. The bad news is this infection rate is climbing at an exponential rate. So we're infecting people who are spreading more and spreading more. And like Skipper has said in the past, it's kind of a spider web type map. For more details on who's most at risk here, just some valuable numbers that I think we should keep in mind going forward, given our known average age of this population. There's been 0 United States deaths in patients under 20 years old. Under 1% fatality rate for those 20 to 54 years old, 1 to 3% fatality with 55 to 64-year-olds, and 3 to 11% in 65 to 85. So for our overall young and healthy population, we can consider most of ourselves under 55 healthy, and that equals a less than 1% fatality rate. Best case comparison for this illness, like Skipper said, is probably the 1918 flu pandemic that hit worldwide. In the United States, we had about 1/4 of our population infected, and of that, there was a 2% fatality rate. We're not there yet with this virus, so again, good news, but we're approaching it with 1.4% fatality rate. Big picture, we don't have a vaccination for this, and we don't have a treatment for it. So as care for the flu has evolved, we've developed medications like Tamiflu that can at least decrease symptoms and transmissibility amongst patients. We don't have that option here, so the question then becomes, what can we do about it? The name of the game going forward is prevention, and we've been harping on this time and time again for several weeks now, but now more than ever, the best answer to beating this is mastering the basics. And I'm just going to say the prevention measures again here because I don't think they can be overemphasized. Hand hygiene. What that means is 20-second hand washing, no less. Spend time with washing your hands, and when that's not an option, use alcohol sanitizer. Social distancing is a huge one. Just for perspective, the vast majority of the droplets that are infected from your mouth drop within 3 feet of your area. So that's 80% of those are falling about within 3 feet. So we go a step further and put the threshold to 6 feet. You have a 0.4% transmission risk if you are within, or if you are at 6 feet from a confirmed COVID patient. So 0.4% is low, and if we toss a mask on that infected patient, or you protect yourself with hygiene measures or personal protective equipment, that risk gets even lower. So that is good news too. And then additionally, that we have the public restrictions and movement restrictions amongst states that will further supplement this prevention. Medical stance on base is we have a limited capability. So we don't have capability for respiratory support when patients get hit hard with symptoms. We also don't have the ability to test. There are 2 testing locations in the Imperial Valley area. That's Pioneer Memorial Hospital and ECRMC. Those are both in a testing limited status, meaning if you're meeting symptoms for possible COVID but are otherwise stable with manageable illness that could be cared for at home, you might not get a test. Those with highest priority for testing include people with severe symptoms like measurable shortness of breath, health complications, and the elderly. So with that, in a testing limited status, the recommendation for management of COVID illness is to stay home and isolate. Here on base, we've had several illnesses that don't quite match the COVID type symptoms, and we've isolated them in an abundance of precaution. We've also recommended that their close contacts isolate, or at least restrict their movement to the maximum extent possible in order to minimize spread of illness amongst the base. And just to clarify, we have very low suspicion for COVID illness in those that are ill currently on this base. And finally, the answer for someone that's significantly concerned with COVID and any severe symptoms, known contact, or high-risk travel is recommended to go to the emergency room. There they will stratify your risk and determine if testing is indicated. If there are any questions regarding COVID illness, please call. That's the recommendation. You can call clinic, you can call the nurse advice line, and that nurse advice line is available 24/7 for guidance and triage of patients that might have questions or concerns. Last plug I'll say is for mental health on this base. When we're caring for an illness, that's spreading globally. There's high do things that they otherwise would like to do. The emotional and mental toll can climb quickly and aggressively. So we got to remember we're all human. Make calls, be as social as you can, and get creative with that when technology allows you that option. And make sure we maintain kind of a team approach to this. So don't lose sight of the important stuff, and that's looking out for each other. Skip.
Okay. On a note, I saw this morning on the news there was a guy walking his dog using a drone. So social distancing from his front porch, letting his dog walk down the street on a leash with a drone in tow, or I guess the drone was steering somehow. But for what that's worth, let your mind wander. All right, so some notes from the XO, who is brilliantly off the screen, but I'm covering for him. What is mission essential mindset? So we talked about not at mission essential personnel, but basically kind of relaxing the restrictions, only bringing those folks in that need to be here, and encouraging telework to the max extent possible. We want to reiterate the work is still happening though. People necessary for the base to have some semblance of operational mission. Front gate's going to be manned, firefighters are still on watch, security forces are still here to defend and protect. Inbound transient aircraft will still come in at some point for gas and probable operations to train the fleet. We are encouraging work from home and teleworking. A lot of employees are already there now and joining us from the confines of their home. Any kind of leave, administrative or environmental, excellent opportunity to get caught up on some work without going through the day-to-day distractions, I've been told. Basically, keep the ball rolling is what we'll leave it at that. Leave and liberty. All right, so late breaking last night, Governor California put out an executive order about asking all residents of California to remain in place unless for necessary travel. Locally here at NAF El Centro, basically have an approval in the chain of command, so that's my boss. Which typically in a normal environment that would be down at a department level much lower, but because of the significance of the current environment, we need to elevate that, and that's for everyone's safety and precaution. So with that, any approval will take some time. Keep that in mind, and it's going to be on a case-by-case basis.
Sir, we still want to emphasize what we consider the local leave here.
Yeah, so anything outside of 100 miles is typically defined as local area for NAF El Centro. That should get you to Yuma, definitely get you to San Diego. Anything beyond that, you need to write a leave sheet. And again, with everything happening and with the governor's restriction, I think that it's going to have to be a really important, I guess, case that would necessitate the travel. So speaking of the governor's executive order, unless you're heading out for necessities, and that's defined in the document as food, prescriptions, and health care, we'll throw gasoline in there and fuel, I guess, at some point too, or to facilitate necessary activities, you basically need to stay at home. He's asked that, and the state will enforce that to some way, shape, or form. So for active duty military, DoD civilians, those of you that work on the base and provide a mission essential function for the base, you are still coming to work as advertised, unless you're told otherwise. So with that, if you are going out from your homes to get food, prescriptions, or health, exercise social distancing, same. If in doubt about any of the information I'm saying, ask the chain of command, get to first supervisor, and we'll try to get that information clear as mud. Again, the governor's intent and our intent is to minimize unnecessary exposure to flatten that curve, like Doc said. SIQ, or sick in quarters policy, very liberal with everybody. If, like Doc said, if you're not feeling 100% right, you should probably stay home to not bring anyone unnecessarily in contact with the sickness or illness, so we can continue our mission. All right, the CYP, still open to mission essential, active duty, and DoD civilian employees who are working on the base. Per the Navy Region Southwest guidance, if an employee is on administrative or environmental leave or telework status, you are required to self-care for your children at home, and parent fees are waived during this time. If there are any questions, again, bring those forward. At this time, I will turn over to the CMC.
Thanks, Skipper. Good afternoon, everybody. Command Master Chief Huber here. I'm the base CMC for El Centro. A couple items I'm going to go over have already been pushed out via all hands emails and Facebook, but I'm going to reemphasize some of them as well. As most active duty sailors by now are aware about some NAV admins that have recently come out, and that's pertaining to our PFA physical fitness assessment for this spring has now been put on postpone until further notice. Advancement exams and selection boards have also been put on hold until further notice. There's also another NAV admin right now stating relaxed hair standards, meaning that your hair can grow out to a thicker bulkness if it needs to, but facial hair regulations are still in effect. So you still need to shave, still need to watch your sideburns, but to maintain a social distancing from barbershops or beauty salons, hair standards have been relaxed as well. Additional SARA programs, as they're coming out, will be posted on the NPC webpage. A link was provided yesterday on our Facebook page with a full resource of all the NAV admins and instruction policies that have changed. Doc emphasized it a little bit ago in his brief about exercising and stress and mental issues. Even with our remain in shelter stuff that we have in place right now that we're saying, stay home, limit movement, that's not saying that you cannot still go out and exercise on your own. Yes, our health facilities are closed. However, every day go out and do something. Even myself, whether I go jog or just a simple cup of coffee, walking the base, go out and do something for every day to keep your heart and lungs healthy. It's more important this time than any time to keep those two items healthy because it's your body, you got to maintain it, do your part. PHAs and other routine medical care that are part of normal sailor Navy life, okay? They are being not postponed, but check with your medical provider as those items are coming up, if they can still be scheduled or not, depending on the check with medical if they can fit your routine appointments in there for now. Another item that came out was talking about PCS moves. There are some sailors that are inbound to El Centro that their orders have already been executed and they're already en route to this base. If those orders have already been executed, they are allowed to still transfer into the installation. Housing is still willing to accept household goods at the front gate and whatever prior arrangements you already made with them. The problem is that anybody who is due to transfer in the next couple months station. So some of the sailors that haven't left pertains to them. You'll see on our Facebook page as well that there are multiple NWR facilities on base and services that are closed. Please pertain to the galley is still open for all 3 meals. It has also been open to up to emergency service personnel that work on base. They can go eat in the galley as well. As far as Kingpin Pizza is still open for takeout only, not to eat inside the restaurant. Other services on the base though have been closed. Pertain to our website for that for more information. The commissary and exchange, as of today, or starting first thing tomorrow morning at our commissary, from 08:30 to 09:30, every day that the store is open, will be for active duty in uniform only with an ID card. I say again, from 08:30 to 09:30, every day at the commissary will be for active duty in uniform only, and you must have your your ID card with you. That is not with spouses, that is just the active duty service member with their ID card and uniform that they may shop in the commissary the first hour of every day that the store is open. From 09:30 till 10:00 will be for disabled and handicapped personnel. That is their time frame that they can go in their store and move about freely with their equipment. Everybody else from that time after 10 o'clock will be normal store hours. There are a lot of limits that are going on in the store, so pay attention to what certain items are on the shelves, but it'll be limited down to 1 item per family, or 1 item per patron for certain disinfectant items, toilet paper, milk, eggs, etc. There will be signs posted and at the cashier's discretion if they feel that you have too many items in your cart. Again, we're stressing no more than 10 personnel at any given time. If there's a social interaction, please, no more than 10 people in any kind of a group activity, maintaining your social distances, avoiding large gathering, including like parties, barbecues. Folks of my sailors that live on the base, please avoid having barbecues over in the common areas. Just maintain your distance as you can. Please have patience coming through the front gate. We only have 1 ECP for this installation. Have patience as our security forces are trying to do their best, screening personnel that are coming through and figuring out, are they supposed to be on here for mission essential or not? Are they screening to make sure symptoms or stuff that are pertaining to COVID. Have patience. We're fortunate enough as the other bases that we don't have as much crowds as larger installations, but please have your time when you're approaching our installation. If you have some incidences where that you feel that you need some more mental guidance or something going on, that please don't forget a great source is Military One Source. It's open to everybody free on the internet. Again, militaryOneSource.com has resources out the kazoo about what you can utilize, including mental health facilities, counseling, any kind of resources. And don't forget, you still can file free taxes for active duty on that website as well. We had some questions about postal services. Okay, the U.S. Postal Service, FedEx, UPS, all scheduled deliveries are still happening on the installation. Nothing has been postponed, delayed. If you order to our official mailing address, we'll send your mail orders over to 214 to get their mail. So please, anytime if you have any of these questions on there, please feel free. My service members that live and work here on base, they can come by my that's all I have, sir.
Okay, good. And one other point, most people probably noticed that with the taxes, I heard on the news this morning that taxes are going to be official word. So you got some time. If you're getting a refund, you can file whenever you want and get that money back. So that's good news, hopefully, for most. With that, thanks for the information. There were a couple of questions that came in advance of the session. I'll go over those, and then we'll see what retirees and others who do not live on the base. The answer is no, but with a caveat. If you're properly credentialed, retirees and dependents are still able to access the base at this time. And again, as I think I mentioned earlier, if and when at a point we need to go to mission essential, and we do restrict access to the base for certain reasons, that is a possibility. But at this point, we are still open. The caveat was, if you're not feeling well and you're ill, don't come to the base. We're going to turn you away at the gate. Question 2 was, as a resident, in parentheses, dependent of a sailor here on the base, will I continue to be allowed on and off even though I have a later shift working in medical staff out in the local community from work, but be mindful of the governor's order to remain in place? If you are specifically helping out in some medical capacity, that's most likely essential service. If you're just leaving else, it maybe doesn't apply to you, so keep that in mind. And with that, I'll look over to XO. Do we have any questions that have come in?
Facebook land, first question, or more a complaint about buffering and lost signal. Answer, yes, you will be able to watch this video later. At a later time, it will stay on the base Facebook's page. Second question, will we be adding more deliveries to the commissary's normally scheduled delivery runs?
Okay, to my knowledge, I'll answer with respect to the commissary delivery. We get delivery once a week here. It's a very small commissary. Talking to the store manager, it would be probably difficult to get additional trucks to come in, but we have asked specifically for those items that are running on short supply, which everyone out in the local community could probably attest to this: bread, milk, eggs, toilet paper, Clorox wipes, bleach, etc. We've asked to get additional supplies of those to help offset the need at this time, so that is in work. But I don't think we can get another truck here. Sorry.
RV retiree residents on base in the RV park.
Okay. You have a current park. You're able to execute that lease. No restrictions other than if you are ill, you're going to be asked to remain in place and kind of self-isolate until you're checked out. I think that probably answers the question.
Do you want to emphasize, sir, no new reservations?
Yeah, we did put a moratorium on new reservations. So if you're here now, you're fine. If there's anyone watching this that was looking to get a reservation to come to El Centro, we've stopped those until further notice. Okay, so we'll hang out here for a little bit and see if any questions come in. It's almost 12:30, so we'll say until 12:30. If something doesn't come in, we'll sign off. We're not very funny up here. We're funny. We could talk about grooming standards a little bit. I know Doc and I both like to have a nice head of hair, whereas you're sporting the high and tight. I think grooming
Keeps me
standards
younger looking, sir.
keeps you younger.
Yes,
Cuts
sir.
the gray out.
Yes, sir.
I tell the barber when I go, cut the gray out. It doesn't work. get there.
I will emphasize for our Facebook viewers that even once this video is done posting and we're not live, this feed will stay on for basically the life of this page. If you do have, the Public Affairs Office will still get a, for some reason you watch this video over the weekend instead, you can still post a question on this page and we will get notified about it.
Yeah, and I do, it is no surprise that we're having some, maybe some technical difficulties. If you're having trouble keeping up, our sound and our mouths might not be matching up. With the additional stress on our networks, both inside the installation and outside the installation, with a lot of folks teleworking now, you're going to see reduced capacity in some way, shape, or form. So, yes, we will post this and hopefully catch those questions. And again, if any questions don't come in, obviously there's a CO suggestion box online. You can go to that. You can send a question this way. We'll answer, I'll answer, and if I don't know the answer, I have a great team here that can help me help you, so remember that. Yeah, so on top of all the stuff that we've covered, I know there's plenty of stuff out in the local community as well. All the papers are running ads about local stores or local businesses who are doing takeout delivery for food. So please, if you're stuck in place, you don't want to eat the same old brick of ramen that me and Doc are probably enjoying every evening. And that is not an advertisement for that company, but there are options. I know a lot of the television services and streaming services are offering free television too. So if you don't want to go get fit, you want to, or you've got your fitness in and you want to, veg out and watch some television. There are options there too with streaming services, so keep that in mind.
I was going to throw on is for everyone that is watching, if we have another next time we have a virtual town hall via Facebook Live, please leave a comment under this video if you think 12 o'clock works best for everyone. If this is best time during lunch. I know that when we were having town hall meetings in a brick and mortar over at the Base Theater, we would always do it around 5 in the afternoon. After everybody was off work, let us know if please, we're interested. Leave your comment on this page to see, this 12 o'clock work for everyone with their families.
Yeah, we're happy to come back in at 1800 tonight and do this again.
Totally, sir.
We'll probably do it smoother too. And I'm sure there'll be updates. We'll see. Any other questions? Nothing coming in? Okay, so closing remarks. Basically, I want to encourage everyone, please check with your chain of command with updates. Doing my best, and there's a lot of information out there. I'm filtering a lot of it to make sure that you guys get the bottom line and what's important, not all the extra stuff. Encourage you not to panic. Take your time. We can get through this together. It's a big deal, but it's not insurmountable. A couple of things I want to foot stomp here. We have this system called AT Hawk, and for all the active duty and probably the employees that work at El Centro and DoD for that matter know what that is. Please check with your chain of command. And if you're not sure what that is, ask your chain of command, because it's a system that basically can push important updates to your cell phone, to your personal email, and to your personal phone if you still have a landline. When there's a need to push information for times in a crisis, and when we want to let you know what's going on. If we've increased a health protection condition, if we've increased a force protection condition for that matter, it gives you an idea of what's going on so you stay safe in a safe place and be aware and be informed. It's pretty cool. I'll put another plug in for if you're sick, stay at home. We don't want people to get sick unnecessarily. And again, a lot of information. CDC's website, cdc.gov, has a special section for coronavirus. Locally, Imperial County Health Department, it's icphd.org. I'll say again, icphd.org. And again, we need to protect our health in order to preserve a ready force to conduct our mission. While the measures on the base and the local communities we've taken might not be convenient, we need to remain vigilant. We need to practice good hygiene and take all necessary action to ensure the health of our sailors, our families, and our local community. So keep the faith that both the federal and local government agencies are working 24/7 to win this fight, and I thank you for your continued support. El Centro signing off. Thanks.